So it'd be great to, is the concept about the product innovations and then how we can enhance the affordability and then access for the base of the pyramid population. Let's have each of you talk a little bit about your company and then your work, and then I have some questions for all of you.
Okay, thank you very much. Okay, this is going to be a very Colombian panel because we are two from Colombia, so we declare you Colombian as well, so we will be three, okay? And thank you very much for this opportunity. Well, we're going to see an overview of Minuto, some product innovation, and then results, and especially lesson learned. Minuto is a private non-profit university. In Colombia, all universities, it's supposed that they are non-profit universities. And high quality, and more on the technical base. And although we offer university education with a low price, that's very important. Lower income students is our target, and we work in order to obtain employability and affordability for them. And access to many places with using virtual learning and distance learning. And our students, in our curriculums, they have a lot of social training, social responsibility training. This is something very special in this educational model. The driver of this Minuto is, well, the situation of our country, Colombia, is in a good moment for the economical and social growth of Colombia. There are many free trade agreements, so that means that we need to have more possibilities of study for young people. And there are not many public offers of higher education. That means that the increase of population do not have access to public institutions. So that's why, and the private, most of the private are expensive according to the capacity of payment of our students. Well, there are not many technical and technological programs, and what we know is that the productive sector is always asking for technical education. And the context of our country, we are 42 million people. Per capita income is 7,000, and this is very important, with large inequality. I mean, the gap in Colombia between society is very, very big. And 30% of Colombians are on the poverty line. Unemployment last year it was 11%, and gross coverage of education is only 42%. From this 42%, only half finish the university. So what's the future of one country? Only 20% of the people, of the young people, have the possibility to finish a high school program, or higher education program, not high school, higher education program. So what we consider is that this type of university is very well received in Colombia. We need more university. We need more possibility like this. And we academic offered, we have many type of programs. We offer academic, professional technician, technological, university, postgraduate program, and with different methodologies, B-learning, e-learning, and traditional. So we offer 124 program, and that gives us the possibility to be in many places of the country with a specific and pertinent offer of in education, because the program here is not the same than in the capital. So if you have a big offer, the possibility to have more students is quite clear. That's something that we consider is new, because there were not many universities with this big offer possibility of academic offers. We talk about quality. It is most important. I mean, the quality is the big challenge of all universities in Colombia, and our university is the big one. Maybe they are not the number of students, but the quality of our programs. Because when you are in so many places, how are you offering a good program? It's something that is always very, very delicate. But all our programs are qualified, registered. We have many accredited programs. We are obtaining an institutional accreditation. That's a big process. Although we are not a research university, we have many research groups. We are a teaching university. We don't pretend to move the knowledge and to discover anything. We pretend is to offer programs that give the possibility to people to increase the possibility in the labor market. And we have many research in some areas, especially in these human and social sciences and engineering. This is very important because it's our student profile. You see, 68% of our students is low-income students. Let's say we are here in the base of the pyramid. 68% of our students. And we have 29 on the other, and very low student on the high income level. So this is something very specific. This is our target, base of pyramid students. And here, from this, 65% are women, and only 35%, 45%, 35% are men. So it's many programs, it's very low income population, and ladies first. The future of Colombia is ladies. They are the future's ladies. And this is what we call in some way product innovation. We are talking here about social innovation and processes and result. This is the type of innovation we're doing. And we consider those are key elements in our program. To ensure possibility for low-income students to go to university. One is the physical and virtual expansion. We use a lot of virtual expansion. And physical expansion, we use our own infrastructure. We use government infrastructure. We use industry infrastructure. We have many type of possibilities to use infrastructure. Colombia, there are many high schools that they offer programs only in the morning, so we use in the afternoon. They have some other that then don't use at night infrastructure, we use at night. So it's one way to have more possibilities. And we go to many small towns and to some urban population, but sometimes marginal urban population. In Colombia, in our cities, there are many universities, but they are dedicated to the urban students more in downtown, and they don't offer. This is part of the model. We offer outside the big concentration of population. And distant learning, it gives us the possibility to go to many rural areas with distant learning. Technology in education, it's the only future to close the gap between education. Yesterday we mentioned that the real challenge of higher education in the world is inclusion. You have to promote inclusion in the education. And the best way to do it is using technology. And we are very good to make alliances, public and private. Curriculum, there are some innovation elements. Curriculum focus on employability and technical skills. Although our curriculum is emphasized on social responsibility and human development. What we want to offer to the student is that they have the possibility to be a good person, good human beings, and then to have some skills that, to have the possibility to join the markets, the labor markets. Quality and flexibility of the curriculum, and this modular structure. So that's allowed to our student, many types of student, full-time student, part-time student, weekend student, night students, early in the morning, late in the evening. So we are very flexible. So our students, you can find young people, 16, 18 years, but you can find 25 or 35 years old students. So it's very flexible, just to open the possibility. Most of them is the first time that in the family that they had the opportunity to go to university. I think 70% of the students, the first time in the family that they have the opportunity to go. Financing, this is something strong we have, because we offer different rates based on the capacity to pay. I mean, we fix the price according to the situation. It's not the same in downtown that in a small town, it's not the same in the urban area that in rural area. It's something not very technical, but it works. And we have a very strong financing system with a cooperative. We are going to see something later on. Another thing that we consider, at least in Colombia, that they have some element of innovation is that diversification of the offer. We base our teaching in praxeology. That means that the students have to go to the practice permanently. And the model, educational model, is based in praxeology. We design the programs according to the regional needs. We don't go, if the area is coffee area, we don't go with, let's say, some other type of medicine, for instance. We don't have medicine, but I mean, we go to different places where what the region needs. And we design, I use a lot of open educational resources. We use a lot of technology. And sometimes they say, well, but you're going to a small town, and how it works, the technology? The technology works everywhere. You have to train the people, you have to have the elements, and then it works everywhere. Quality is the other, let's say, innovation that we consider. We use a lot of free software, and we use improvement in quality management system, but our big challenger is to improve the quality. That's the real target in our organization. And innovation, we talk a lot about social inclusion. We have, for instance, this scientific park of social innovation that is a platform to solve social problems, bringing different actors to solve the problem, the government, the university, the private sector, many actors in the same platform. It's a technological platform, and then we solve problems in that way. Apply research in the solution of social programs. I mean, we research, but in this type of research, it's a model of education for development. That is a very strong concept, very European concept many years ago, and it's give the conception of you had to work and educate just to improve not only your living, but your development of your region or your town. And we have some other program, for instance, first year program. I mean, we don't allow the people to be in the university alone. We have many mentoring programs. This is our educational model. You see, we are based in human development and social responsibility. That's the main of our model. And we give these professional competence so they can join the labor market. But here is what we more do around these two things. In the virtual and distant learning is about the same. This is a program, autonomous and collaborative learning, very flexible, all e-learning, big learning, distant learning, and the impact to the people, medias, and technology. We use a lot of technology to obtain this. We use many platforms, we use many banners, softwares, all type of new technologies. We include this because the curriculum to job requirement, as you can see, there are many spaces where we need more education. For instance, technological, technical education. We need more education according to the job requirement. So we try to fill where these needs of our country. In our country, there are some other areas, for instance, in middle management, there are an important number of undergraduate, but of course, have to be 100%, but we look job requirement to design our programs. We are very close to productive sectors. We have a lot of program in coffee, BPO, IPAL, construction. So it's a good offer because it's always we do it according to this productive sector. They put the knowledge, we put the technology, we put the educational model, and then you offer very pertinent programs. And of course, we have in the curriculum, we have a common study in a national level where we are in 42, 46 places, 82,000 students. So we have a national level, some common studying programs. We have flexibility, I mentioned, virtual courses, and resale and social projects, we mentioned already. This is something that we consider that is relevant, is pricing and financing. As I mentioned, we have the price of the programs with authorization of the education, Minister of Education. But according to the place where we offer the program, according to the modality, we give a lot of subsidies. There are some places where, according to the authorization, we give 77%, 67% of discount of subsidies. For instance, in the Bogota, in some areas, in Medellin, where there are so difficult situation, we offer a lot of discounts. And according to that, for instance, in our main campus, well, we don't give a lot of subsidized, but this is it's designed so the people can have a good price, have a good quality, and to have the possibility to join a financial system. This is the financial system. We have a cooperative. The cooperative is integrated for all the students. And we create this because there is a lack of financing offer in Colombia. I mean, the main limitation in Colombia to go to the higher education is the capacity of the systems to finance. So we create our own system. It's short-term credits, minimum requirement. We had to change this because short-term means every 6 months they had to pay and take the renewal, but we hope someday we can have more potential capacity to offer a long-term credit. And the average credit value is $400 per semester per student. Last year, we offered 56,000 credits for $36 million. I mean, this is something very, very important. And this is the number of the result. First, 83,000 students now with this increase. They have been very important, the screens. 40% using some type of virtual education, 66 women, and 70% of the students receive loans of our credit system, 70%. Of course, our cooperative goes to the government and administrates resources from the government. We don't have the capacity to. So in some way, it's administrate many funds from many places, but how can you get a credit in a very small town, 10 hours by car from the place where you decide the credit? It's almost impossible. So that's why with this system, we obtain these good results. 11 campuses, 48 sites in low-income neighborhoods, 26% annual growth in enrollment since 2006. Well, we had double-digit revenue since 2011. Non-profit means that you have to make profit, but you have to invest the profit in the same organization. That's what we do. Jobs, because this is, according to Colombian figure, this is a big university, and people ask, where are your people? Are they working? According to information, the Labor Observatory for Education, our students, on average, they have a bigger percentage of formal labor or work than the average in Colombia. That means that they are very well received, they are very well accepted in the sector. Now, what we learned about all this? First, university had to be very close to the student, let's say. We don't like to use the word client, but we had to be very close, go to them. That's not very common. Universities say, we have the program here, who wants to come here? No, here is on the other way around. What do you need? We go with the university to your place. Second is tuition should be according to the pocket of the students. That's very important, low price. The other is university had to be involved in educational loans. The other is quality virtual and distant education. And this is something that we is very successful, is the university must be near the school. I mean, a student can start the university when they are in high school. They can take some academic credits, so in some way, and especially in some regions, when the student is in high school, they already have academic credit. And that's very, very, very positive. Lessons in quality. Quality is an imperative. You cannot offer bad quality because it will be a fake. Quality pay. University have to invest in quality. Many universities don't invest a lot in quality. But if you invest in quality, then you will have more students. You can increase the fees, but quality pays. And the quality had to be not only in the academic, but financial, technological, and management. And technological, I mentioned, is vital to support the teaching quality. In relevance, programs should be relevant to local and regional development. Program must be living curriculum according to the need of the productive civil sector. We are very close to people who is always talking about our curriculum and changing and giving some suggestions. And here something in person, new program must be positioned in youth minds. Future plans to be more near the users, the students, not rather than in the academic product. More service than product, more service. Achieve the institutional accreditation, well, to promote all our social innovation park, extend the new model of educational financing. This is a big point because we are increasing and the national system of financing every time, although it's bigger every time, have less possibility to offer, to finance our students. And of course, as is normal, who are the persons that the normal system give the credit? The best ones. So you always, the ones that are not best, they are not coming from the private school, they are not coming from the best quality high school, they don't have the possibility to obtain credit. And if they don't obtain the credit, then they cannot go to university. So that's important. New technology, transfer model, we are talking to this. You mentioned replicate to another regions in Latin America. We suppose in 10 years we will be in some other places and get international financing, and that's why we are here with IFC, and we are crying every day to get more international financing. And thank you very much.
Thank you so much, Leonidas. Next, Manish. I understand that
Manish,
there's
do
a
you need this,
video
Manish?
you wanted to share, but
Do you
if you
need
could share a little bit first.
I can share something about the FINO incorporation, and as a person and as a company, we learned a lot thanks to IFC, World Bank, and that time Women World Banking. As FINO was being formed, we relied on many of these organizations to help us think through and see what's happening globally. So we went to Colombia at that point in time, and Cali was the place we went, Bogota as well, but first Cali. And my first learning as I landed in Cali was that India is a safe country. The taxi driver picks you up and says, "I'll take you to the hotel. If the car stops at the signal, don't speak in English. Don't talk to me if the car is stopped. Otherwise, we can talk. It's okay." 3 days, we were practically in a house arrest in the hotel, can't step out. I don't know if it's still that unsafe or they were trying to be extra cautious. I'm sure people coming from Colombia may not realize it. But third day, they permitted us an escorted walk of 1 kilometer from the bank where we went to see to the hotel, back to the hotel. And then we went to Brazil. We saw many of the agent models there. And in a way, we adopted that model in India. We took our regulator from India to Brazil. Even for our trip, World Bank helped us a lot in setting up the meetings and also sending somebody from Washington to be the translator for us to understand how they were developing the model. That time also there was this debate, would this happen within the big organization, a big bank, or would happen separately? I think Bradesco was debating that. Lemon Bank was a bank dedicated only for this, and we came back and we also had similar debate within ICICI. It's the second largest bank in India. That's where we were housed then. And then FINO as an entity was carved out and put outside ICICI Bank. And we were asked to then go and service all banks in India, not just ICICI, because like any other big bank, this debate continues. Ever since then, I've seen about this customer segment. Would they want to touch this customer segment or not? And I think in the morning, I asked that question, and it got answered. Novartis, the example that they were giving, my experience also has been the same. Just the sheer scale of this business scares off a large entity. It is a micro customer business, cannot succeed without scale being there. And of course, the larger numbers are unserved, let's say whichever segment we are discussing, and it would require scale. The bigger organization is scared of scale. They have an up and running successful model. They can't afford to risk it for the sake of serving a new customer segment. They don't like it. Even a small percentage of this big base, now we service 70 million customers. We can, any bank we go to, any forum we go to, it can evoke two kind of reactions. One to say, wow, what a big number and what all you have done. Second to say, oh, 70 million, even if I have 5 and out of that 1% write a complaint about me to something because bad service quality happens, and we did here, the distribution chain, how important it is to have a good distribution chain and how it can cause issues. The big entity is scared, right? Each country, I'm sure, has regulators who are as sensitive or more sensitive to the poor person than to the rich person. So it just scares them off. So I think, few of the things, and I'm thankful to IFC for organizing this, a few elements which repeatedly came out yesterday, today, I think are the fundamental blocks of this business, whichever industry we are working in. We had those experiences, and I'm learning more and more from others to see how they have addressed similar challenges which we have faced, addressed a few, and still a lot more to follow. This is a short video just covering what we have been doing till now, and then I would want to come back to discuss the innovation part that we have been doing. But coming back to our discussion on the innovation, I had a small presentation, but maybe I can keep that in the background. I just wanted to share, in a way, a common theme that we have been discussing since yesterday, and the innovation layer around that. Now, on one hand, we were discussing the parallel models which come up to the inclusive businesses that we all run. And broadly, we said governments as a category and the big MNCs as a category. And we have also seen exactly the same thing happen in the country. Both these set of entities, in a way, do not do things which pass the filter of commercial viability. And it can be on many aspects, but broadly said, they don't do that, which causes the difficulty in innovations. And I would want to give you a few examples as we go along. But core on coming back to the innovations, in our experience, it takes 3 or 4 forms. And I heard it in various discussions since yesterday repeatedly. One is the technology innovation, then the process innovation. Then we saw, in a way, everybody saying that we need to develop the ecosystem to deliver on this market. And then lastly, I would say the business model itself. Now, in our ecosystem as well, on the technology side, the very basic innovation that we were doing was adopting what we saw the customer requires and was working in the other places. I gave you the countries that we visited and saw others in South Africa, Indonesia, everywhere, and adopted it to the Indian scenario. So we picked up the basic roadblocks in India of saying power connectivity is not available. So how would we enable banking transactions for these customers? So we gave the customers a smart card. The smart card could store the fingerprints of the customer to validate the customer, that's the right customer availing of the transaction or the facility. And we stored all the customer record on the card. To the agent, we gave a small handheld device. You saw that. The agent reads the card using the device, does the transaction. Whenever connectivity is available, the transactions are pushed to the backend. Whenever power is available, the device is charged and the system grows. Today, 70 million people use it. Everybody is captured, everybody's fingerprints are captured, they work. There are many debates which continue going on saying, does fingerprint work, doesn't work, can we have an alternate? And in our labs, I can show you all possible combinations. Smart card, max type card, contactless card, no card, device A, B, Z, mobile banking, everything. What works on the ground is this. Day in, day out, we do roughly around 10 million transactions a month. It works beautifully well. But then there is a need to innovate. Right? Innovation has to be constant. The trouble happens when innovation happens from non-commercial entities. So we have, you saw a small example, UID. In India, we are trying to give an identity card to everybody, especially the poor people. And we think it will help us to take many services to them, including government benefits. But in the process, we are causing this confusion because the government is coming in and saying a particular architecture should be followed to do government payments. It's cardless online. Connectivity doesn't exist. Everybody recognizes it, everybody knows it. But government is government. Same way, Intel will come up with a device. Very nice. It works very well in seminars, in tech labs. Doesn't work on the ground. Microsoft will come up with another version of something. We'll showcase, works beautifully well, we'll go and show it to 10 different regulators, 10 different clients. They all like it, doesn't work on the ground. So you have, I don't want to call it unnecessary innovation, but people developing something because they have to. Sometimes I visit these places, I see their tech labs, they are good products, excellent products, and they have spent millions on it. I just wish they had given me those millions. I can put them to far better use than what they have done. But then I'm sure all of us face a similar thing. The second on process. One very basic thing we did here and continues is that the process is paperless. We don't notice it, but all our current banking processes are paper-based. It works well for us or with difficulty with us. We also face those challenges, and that's why in India specifically, we saw the retail market grow in the banking when a direct selling agent stepped in between. And we saw Horii also explain that he has to have those camps where people come in and he explains how to avail of a loan, what documents they need. Somebody facilitates the process. It's paper-based. Somebody signs on a check, somebody signs on a deposit slip, fills it up. Poor person can't do this. Illiterate person can't do this. Just making it paperless makes it far more effective than otherwise. And if you see the general trend, which is happening globally, all industries, not just financial industry, we are moving in the self-serve direction. We book our own tickets, we book our own hotels, we search data ourselves. The assisted or somebody setting up a dedicated service for us for doing anything is going away. Thanks to internet, information is freely available across the world, and we are all moving to a self-serve direction. But the poor person, as yet, is not ready. Even education, if you want to pick up, there are many online courses available. In fact, most of the big universities have made their entire content available online, free. But self-serve for the poor person, I think as yet is some distance away. Assisted model, and we just saw an example of a beautiful university model, will continue for that person because the skill set is very, very low, very, very low for them to be able to do a self-serve kind of a model. Third, in terms of ecosystem, we have all experienced it, in bits and pieces. You have to develop the ecosystem. 2/3 of our revenue comes from government payments. We actually work with the bottommost part of the pyramid, not the upper 2/3 as we were discussing yesterday, but the bottommost part, what's called as the below poverty line in India, less than $1 a day income. As much as 60 million customers out of our 70 will be below poverty line customers. That's our key customer base, that's our key revenue. Government is a strong anchor there for making that payments, but when you want to handle it, the backends of those government departments or those agencies are not ready. So when we work with the government, let's say one scheme that we handle is what's called as a National Rural Employment Guarantee Scheme. So the poor person is assured 100 days of work a day, paid $100 a day. That's $2 a day for a family of 5. 100 days in a year. That's what the government guarantees to them. But to do that, they have to generate work. They have to mark attendance. Based on that, calculate the wages and then pay. So our role comes in when the payment order, so to say, is generated and we then pay. But a lot of the work prior to that, we end up doing pro bono. Because if that doesn't happen, this doesn't happen. We make payments on behalf of a public utility for the milk that the farmer supplies to the utility. So they procure the milk based on the quality of the milk, they give the payment to the farmer, we enable the payments. So we had to develop solutions for them to assess quality of the milk, the fat content in the milk. Now sometimes we wonder, is it a new line of business we are opening? Or is it just something that we have to do to enable the ecosystem? Because otherwise it will not happen. And that's where we start relying and our partnership with IFC works the best, because we are able to then develop new things, which is not necessarily our line of business. It doesn't give us revenue, right? And then there is bad innovation. As I said, in my lab, I can show you all possible combination of architectures. We had to do it because the ecosystem wanted it. Our banks wanted to see it from us. Our government wanted to see it from us because we are market leader. We are supposed to be ahead in terms of technology. Staying with dull and boring smart cards all our life, how can it be? We have to necessarily innovate to go ahead. I don't think we have to necessarily innovate to go ahead. Innovation, I think, we'll have to do somewhere else, not just in the tech architecture. And lastly, I would say on the business model, just short and sweet, I think all of us have experienced it. We have to reduce the cost in line with the revenue. most of the models fail because they estimate the cost it will take them to deliver, and then they take it to the market, and then they realize market doesn't want to pay or can't pay. And then, you come back and start thinking what went wrong. I think that's the one fundamental building block. We work with, our average revenue per customer is $2 a year. That's what we work with. And we make money for everybody, all our shareholders. And we are growing still at 30% year on year. We do think we have now covered the below poverty line customers in India. And the next innovation for us will be when we'll go to the above poverty line customers in the country. Still poor, around $5 a day broadly is what they earn per household. And that's where I think not just on technology, but on all these four fundamentals of the business, we'll end up innovating. Thank you.
Thank you so much, Manish. Last but not least, Dr. Victor.
Hello. Okay. The history of the Fundación Cardiovascular de Colombia started 32 years ago when I finished my medical school and went to a small town, something like 2 hours and a half from my city when I born. And in that small place and in all our area, the only thing that I looked in that time was the natural history of the disease. With the patient with heart disease, we can describe, like 100 years ago, what happened with that patient with coronary heart disease or even congenital heart disease, because nobody can do nothing for that. In that time, I promised to me that I have to change that situation. I start to work in to have the solution. I went for my training in general surgery for 4 years and back to my city, and we founded the Fundación Cardiovascular de Colombia. Fundación Cardiovascular de Colombia is a non-profit organization. Like Leonidas said, all our profit is reimbursement in the Fundación program. It's located basically in Bucaramanga, but we have right now 4 hospitals in different middle-sized cities in Colombia where there are not very good medical services. We look at the places where no exist very good medical service. We implanted the Fundación there. Right now, excuse me. Right now we have almost 650 beds. We take care of 150,000 patients a year, included in hospital and outpatient. And in the telemedicine program, 2,800 patients a year. This is one of our goal. We grow up in the EBITDA 32% in the last 8 years. And we saved to the system $10 million in our program. What we offer? Basically, now, high complexity services in health. Basically, heart services. We are mainly Heart Institute. In our area, we serve it in all northeast of Colombia with a population of 15 million in the different places where we're located. In Colombia, there are only 2 hospitals accredited by Joint Commission International as international hospital. The first one is where the Fundación, and the second a year after in Bogotá. What are our goals in the future? We want to focus, like I tell you before, in small cities or middle-sized cities where there are not very good medical services. we are looking for take care of the patient, and most of the, or 100% of the patient coming, the revenue is coming from the health system. Colombia has universal affiliation or universal insurance. Everybody in Colombia have medical covering by the government. That it was achieved in the last 5 years because the court compulsory to the government to achieve that goal, that's 100%. We work very hard in different ways to reduce our cost of the services, trying to give more services to the people. My main goal is to save life. And the main goal of the director of treasury is to earn money. But I always defend the quality of the services and always defend the life of the people. I am heart surgeon. Basically, I treat small kids in with congenital heart disease. Most of my patient is less than 3 years old. Because in my 3 months old, in my department, we can find patients with congenital heart disease older than 6 months, because all the patients receive medical treatment as early as we can. No list, no waiting list. Okay. Our patient, basically, 90% is patient coming from the system. 10% is international patient who go to our place to get treatment, basically from the Antillas, from the island, and some Central America and Ecuador and Peru. And this is my main goal. This is 35% in the last 8 years of our patient coming from very low income, less than $7 a day. Our hospital is five-star hotel hospital. It's a beautiful hospital, and we manage the poor people like rich people. Because, usually the patient, when they go out the hospital, go to my office and tell to me that they never feel that in some place treat them like rich people. And this was on our main satisfaction, to try to treat the poor people like rich people. Okay. One of the things that we developed in trying to help more people in the last 8 years was the telemedicine program, because it was the best way to reach more population and to bring the Fundacion, the high complexity medicine, to faraway places, like in the jungle. Some of the places, they don't have, in that place is no road, no airplane, no airport. We have to go by boat, a small boat with no motor, to bring services there in the jungle or some places like that. Then we want to look or find the people far away or where the people need us. Generation impact, social impact, by giving access very easy. We don't wait that the people go to the foundation. We go to the people, even if they are very far away. Offer specialized medicine located in the rural area in real-time medical assistance. With this system, we lower the cost of the services, and we diminish the risk and mitigate the risk of the patient. Looking or using telemedicine to reach the BOP. We use web application. We developed in the last 15 years in our software factory, the best software for hospital and medical services in the country. There are more than 50 hospitals with our software. This software has 25 software modules, more than 5 million medical records. We in 25 medical center, big center, and the rest in the more than 100 in small center in telemedicine. We have images in centralized images. The equipment we develop in our factory, the hardware equipment, the mobile ICU, intensive care unit mobile, the telemobile for medical consultation, the EKG. We developing the guidance to develop in more than 200 practitioner doctors in remote villages in more than 76 very far region of the Colombia. The tele-EKG is electrocardiogram, and the ICU by telemedicine in 26 private and 22 public hospitals. And the support, technical support, the software, the team developing software is part of our team. The result, we served more than 2,500 patients in 3-year period by telemedicine at the ICU. 25 of the patients don't need, we treat in the place, in the small town, very poor town, without moving the patient from that place. The infant mortality, we can drop from 70 to 28% in the old population. And we training almost 800 professionals who they move to the very far away places in the frontier region. Working with the Ministry of Technology and Communication to expand the internet access in that place. And we accumulate savings to the system for $10 million. We developing in our model of services and other products different than medical services. We have a factory of medical products like surgical cloth, sutures, surgical suture, and another item necessary in the services. Our factory of bioengineering, we produce hardware and assemble different type of equipment for monitor or ICU, intensive care unit, especially for telemedicine program. We developing the telemedicine center, the National Telemedicine Center in Colombia. And we created 4 years ago the Corporación University, who is the main strategic to develop the human resources and the foundation. The software company, our software factory, and we developing a commercialization area who import from 50 countries in the world supplies and sell to different hospitals and use it for us, diminishing the cost of the services. What next step? What's the? I think in the overall point of view of medical services, the high risk or the high complexity hospital is necessary, but it's not the solution. The solution is in the primary care. We don't want to wait that the patient gets sick to treat them. We want to work very hard with the government to implement the best primary care program in Colombia and even for the rest of the world. For that reason, we are developing, like I call, the digital health system in Bucaramanga. Bucaramanga is my city, is 1.2 million population, is in the metropolitan area. there are 4 cities. The biggest is the Bucaramanga, 500,000 population, and the rest in the 3 cities close Bucaramanga. And we are trying to get one city, because the administration, the cost of administration, that 4 small cities is higher, and we can get some money to change to one city. We want to connect all the professional, from primary care to the high developing hospital. Patients who receive diagnosis primary care in the primary care facility. The software platform is already we're developing in the factory, and we are give by free to the city the software. It costs more or less $5 million, with very strong learning and medical record collection, consultation and diagnosis services by telemedicine. The pilot is in the pilot phase in Bucaramanga, and the next step is to roll out in another small cities. This is the World Health Organization program for the new topic in medicine. Basically, primary care, technology, information technology, integrated network. And this is our future. This is that we want to do in the city, and after that, to increase to the rest of the country. Basically, very strong public health. This is the main achievement that we want to have. To take care at the beginning of the patient, the family, and the community, with registration of every citizen with geolocalized in dim houses. With all these programs, and with very good vaccines, and with very good registration and preventive medicine, we want to diminish the movement of the patient to the system, because we want to strong the first level of primary care, and most of the patients at the beginning of the diseases treat in this area, and try to diminish the disease, that less people go to the 3rd level of the hospitals, and if they go early, not too late as happened now. And the third part of the system is the information system, and that is possible to have a very good inspection, monitoring, and control of the system. All this program is developing or is functioning by the platform, the internet platform called Swiss. Is integrated platform that integrate all the steps. Is this integration, this software was created for us, and we are going to give to the city by free. All the system is only, each people has only one medical record. Their medical record is installed in this data house of the city. No, right now, each hospital has his own medical record. Right now, we want that each habitant, each people, have his own medical record in the cloud. Then everybody in every hospital, every small consultation office can access to that medical record. again, for emergency center, one regulation for emergency center, the support for diagnosis, one, the medical appointment, the central medical appointment for all the city with very strong telehealth and telemedicine, and covering by teleeducation in all the steps. At the end, we are going to have a very good balanced scorecard with all these products that we can know in the future exactly what happened with the health of the citizen, on what happened, which hospital have beds available for one patient. And right now, it's very difficult to get the information because nobody have the right information. This information is centralized in one control monitor. This is our goal in the future, a strong telemedicine in all the country. Colombia has 1,020 towns. We want to be in each town of Colombia. And this program in the future, we want to expand to the rest of the country. For that reason, it's very important, this pilot program in our city. And all these things is our proposal of the Fundacion Cardiovascular. We are thinking in more than take care in our frontier, in our door. We want to go outside and to help more people. And the best things to help people is to introduce the best system based by software who integrate all the treatment in the all steps. Okay, thank you, Toshi, for your invitation. I appreciate very much to be here and to explain to you and the rest of the audience what we are doing and what is Fundación Cardiovascular de Colombia.
Thank you very much.